Thank you, Madam Speaker. I rise this evening in strong opposition to SB 525, a one-size-fits-all bill that threatens to restrict healthcare access for our underserved populations in the rural and frontier regions of California. Even with the delayed implementation, this bill will have disastrous impacts on independent medical facilities, rural healthcare centers, and hospitals. The recent amendments clearly indicate that a deal has been made, leaving our rural clinics high and dry. The 1st Assembly District is made up of 11 rural counties from frontier counties covering approximately 16% of California's geographic area. Let me say that again. I represent 11 counties, 11. In a region where medical facilities are scarce and attracting medical professionals is an incredible challenge, SB 525 would put undue strain on an already struggling rural healthcare sector. SB 525 will decrease access in essential services for underserved and offered lower income populations in my district. It will have a detrimental impact on the capacity of our rural and frontier health centers to provide care due to the cascading effect these wage increases would trigger without sustainable funding. One rural healthcare network of clinics within my districts serves residents in some of the state's most remote counties, including Lassen, Modoc, Siskiyou, and Shasta. They accept all forms of insurance because often their clinics are the sole healthcare providers in these communities. Medicare, like Medi-Cal, reimburses at a flat rate, while private insurance offer even lower payments, leaving the clinics unable to leverage that large patient volumes for negotiations. This equates to $2.5 million increase to the budget of 7 clinics, which currently operate in the total annual budget of $16 million. Rural areas have fewer residents, often due to limited employment opportunities, but those working in those medical fields do so out of the desire to give back to their communities. I'd like to read a quote from the Mountain Valley's Healthcare Center's CEO and a close personal friend of mine. Permission to read?
Without objection.
These provisions would lead to an extreme financial hardship, leading to a significant reductions of patient services or closure altogether. We worked hard in 1998 to revitalize clinics in the northeastern Siskiyou County because patients were going to the emergency room across the border in Oregon for primary care services. This legislation, as written, will close Mountain Valley's healthcare clinics. And this scenario that we once lived will happen again, but in more communities. The constituents of the 1st Assembly District should not lose access to vital medical services due to a one-size-fits-all legislation. This will, without a doubt, break rural healthcare systems. This year, we've experienced hospital closures across the state, forcing more Californians to struggle with access to healthcare. If you support this bill, you're supporting the bill that will inevitably shutter medical clinic doors, particularly in poor rural communities. Members, right now in my district, currently where I live, you drive 2 hours to have a baby. This is incredibly detrimental to my district. And you know I don't rise very often, but I am very passionate about this, as I think you can hear me this evening. So I know a deal's been made, and I had to stand today to stand for my communities. But I will be a strong no, and hopefully when something does detrimentally happen, the rest of you will stand with me when we need to fix it. So thank you, and I encourage a no.